let's talk about Big Pharma, and let's talk about some of these things you mentioned, like bipolar and ADHD and all these other things. I don't even know what those mean anymore. But clearly, prescriptions are being written left and right. And I know in America for children all the time. That hasn't hit the UK as much, but we're usually a few years behind. What don't you like about what's happening there? What needs to happen for that to be done intelligently? Or should they stop writing those prescriptions?
Well, I'm not a fan of the government telling doctors what to do. That sort of happened during the pandemic, and it was not good, right? Suppressing free speech is a bad idea.
I agree.
From my perspective, it's a shit show. 85% of psychiatric drugs are prescribed by non-psychiatric healthcare professionals in 10-minute office visits. So if you just start with that, you realize this is going to be trouble. Because, people who are not experts in these medications are prescribing them like candy. And in the early 90s, even psychiatric visits, when I was trained, I'd see my patients for an hour or two a week. And then managed care took over medicine, and they relegated psychiatrists to be the prescribers. And all of a sudden, I find myself being pushed to do 15-minute med checks. Now, I decided, no, that's not me. But that's what's happening wholesale in the United States. So I think stopping that practice of being the prescriber and being the whole person doctor, like many of us, at least in the 70s and 80s, were trained, is a more rational approach. And educating people that depression is not an illness. It's a symptom. I mean, it's sort of like saying you have chest pain, and nobody gets the diagnosis of chest pain. Why? Because it doesn't tell you what causes it, and it doesn't tell you what to do for it. So I think our nomenclature, how we name things, is just a bit bizarre, because you can be depressed from low activity in the brain, from a head injury. You can be depressed from high activity in the brain, from inflammation from COVID. You can be depressed because you have bad thought patterns. You can be depressed because you have mold in your home, or you have Lyme disease. So I think what looking at the brain did for me, I went, oh, depression's not one thing. ADD or ADHD is not one thing. Bipolar disorder is sort of the fad current diagnosis. Oh, they're bipolar. Justin was diagnosed with bipolar. He was on my floor, crying, screaming, not being able to sleep, but he wasn't bipolar, which generally shows up on a scan as too much activity. He had too little activity. So I think we need to change the paradigm away from you have this, and you said it right, it's sort of vague, amorphous mental illness, to your brains could be better. And if we think of it that way, everything changes.
Do you think psychiatric drugs should be prescribed in some situations, a large portion of situations, or not at all?
Clearly, they should be prescribed in some situations, right? I mean, I never say you shouldn't take insulin or you shouldn't take medicine for your heart. The brain can have problems just like your heart can have problems. But, in our Washington, D.C. clinic, we saw a 12-year-old boy that was on 17 medications. I think when you actually look at the practice of psychiatric medication, it's ridiculous.
If we started reducing prescriptions by 90%, would that be a pretty good start, do you think?
I think it would.
Yeah.
And I think suicide would go down, it wouldn't go up. I mean, all of the antidepressants have black box warnings, especially for teenagers, because we know they don't work and they make people worse in a high percentage of cases.
So Jim Rickards has just recorded a video that's not available to anyone in the public, and he's going to be talking about how this upcoming recession is going to be fast, it's going to be bloody, it's going to be nasty. But at the same time, he's going to show you how you can position yourself to profit from all of this chaos. Now, we've made this video only available to our viewers. Go to londonreal.tv/Jim. Watch that immediately. I can't say enough good things about Jim Rickards. He understands the global economic system better than any guest I've ever had on London Real. His predictions are almost uncannily true, and you can learn how to profit from his vision, from his expertise, and his understanding of economics. So go to londonreal.tv/Jim or click the link below. It's an excellent, excellent look on what's going to happen in the future and how you can position yourself to profit from that. Jim is one of the best in the business, one of my favorite guests on London Real, and he's very, very good at predicting the future and showing us all to profit from it. So click the link, and I hope you enjoy. Hey, it's Brian Rose, founder of the DeFi Academy. I've told you my 4-week crypto bootcamp is amazing, but don't take my word for it. This is what my students are saying.
The DeFi Academy was an amazing experience for me. It took me totally out of my comfort zone.
In this course, I was challenged, I was held accountable, and pushed to do things that honestly weren't always easy.
It's been phenomenal, and I can't believe we're already up on our 4 weeks. It has flown by.
Going through this DeFi accelerator by far was one of the best courses I've taken.
You do this course, you really get into the nitty-gritty of the activities that will make you comfortable with decentralized finance.
Thank you so much to Brian and everyone at London Real and the DeFi Academy for even putting together an amazing course like this.
Anybody else that wants to do it, please sign up. It is well worth the money.